Welcome to our Pick the Brain podcast. I'm Dr. Caleb Frankel. I'm an emergency room veterinarian by trade and founder of Instinct. We started this new podcast because over the years of building Instinct, we've been really fortunate to get to know what I think are some of the best and brightest hospital leaders in our field. And they tend to self-select to use Instinct. So we get to hang out with them and learn from them. And so we thought we'd try something new, this podcast, to share some of that learning on sort of all things hospital operations and leadership and ownership trends, and of course, technology. And today, I'm really excited because we have a colleague and a friend, Dr. Beth Davidow, on, who is a veterinary critical care specialist, but also the co-founder and CEO of Timberline Veterinary Emergency and Specialty in Seattle. Beth has done everything from starting veterinary centers, this is not her first rodeo, to teaching at veterinary schools, teaching up and coming students, and including acting as the patient safety leader for a large group of hospitals. So there's actually a lot we could pick your brain on, and we debated because you have some cool hospital ownership journey stuff, and we'll have to have you on again for that. But today we're here to pick your brain on all things patient safety in private practice. And this is, as Beth knows, this is something that's near and dear to my heart, and definitely yours. It's something we bonded over when we met, and it's always been a big driver of why we started Instinct. One of the first early sort of stage features we admittedly painstakingly developed with your help, actually, is what I think is still the only, true drug safety warning system built into a modern software for veterinarians. And this is harder than it sounds because of this per species nature of it. And the fact, which most people don't understand, is there really is no data set to license that has been curated for this. So we kind of had to create our own peer-reviewed process for this. So we bonded over that for sure. And, I'll just say a little bit about patient safety. So, in human health, medical errors and patient safety is a pretty big public health concern. And, there's a bunch of data that's cited. One of those data sets is from the NIH over the past decade or two, where they looked at patient safety data and medical errors. And, the sort of stated fact is that it's somewhere around the third leading killer in human health. And, for those who don't know that, if you do the math, that equates to like 1 to 2 jumbo jets worth of humans die per day from medical errors in human hospitals. And that's a crazy statistic. And I think Beth and I would agree we don't have the data to know in veterinary medicine, but we all know it's probably proportional. And so that's what we're here to talk about today. So thanks for joining us.
Yeah, well, thank you for the introduction and thanks for having me today.
Yeah, so I think the first thing I'd love to ask you about is the why. So I think for many people, it just sounds obvious. We should care about patient safety issues at whether it's a teaching hospital or a regular hospital and in veterinary medicine. But I think the reality is it goes beyond that. Patient safety issues are kind of the sneaky problem that affect us as clinicians and your staff and your retention and your hospital reputation. And so I'd love to hear just tell us how you got into patient safety as sort of a thought leader and why you think this is really important for hospital leaders to care about.
Yeah, so one thing that was really interesting is I was part of a large group of hospitals and I was on the medical operations board. And we as a group of veterinarians wanted to figure out how could we make sure that our group of hospitals was providing quality care. And what you find is when you talk to lots of different people, we don't have enough evidence sometimes to say what is true quality. But if you start looking at definitions of what quality is, one of the definitions of quality is being free of deficiencies. And you actually start to realize that there's lots of things we don't agree on, but all of us agree that we never want never events to happen in our hospitals. There are these things that are devastating when they happen: pop-off valve errors, heating pad burns, insulin overdoses. And there are these things that actually, when you talk to medical leaders who've been doing this for a long period of time and you ask, have you ever seen a heating pad burn? Have you ever seen a pop-off valve error? You everybody has. And the fact that everybody has is a problem. And so you start to realize that maybe the way that when lots of people disagree about the best way to treat a septic abdomen, but everybody agrees they shouldn't get burned or have an anesthetic death, that actually you could build quality sort of from the bottom up.
Mm.
And so I got really interested in patient safety with this idea of if we can prevent the very worst things that happen in hospitals from happening, we're ahead of 90% of hospitals.
Mm.
And so I've gotten really interested in this idea of these things don't have to happen. And the way you prevent them is not by telling people to be more careful, but by building systems. And so, really starting to get into system thinking around safety actually makes it so your staff doesn't feel awful about something that happens. You don't have clients that, write about you all over social media. And you just don't have to feel that at the end of the day because you
Mm.
haven't had those things happen because we know how to prevent them.
Yeah. Okay. I love it. So, okay. So you sort of recently opened a brand new specialty emergency center in Seattle, one of the,
Yep.
larger cities. You've done this before, I alluded to. Um, but when you were designing this new center, which is a really important center for your community, and, it is, we consider what we do a community service. You're open 24/7 for all the referring veterinarians. I know how you think. You try to provide amazing care and build a culture around that. So, but when you started designing Timberline, when you thought about how you were going to install patient safety, whether it's culturally or initiative wise, what were the top things that you sort of set out to do? If you could, impart those to up and coming leaders or hospital leaders who are thinking about this.
Yeah, I mean, I guess there's a number of different things we did from thinking about like common things happen commonly. And so one of the things that I urge people to do if you're thinking about patient safety is to think about what are the top 10 errors that happen in a veterinary hospital and what are you going to do to make sure they don't happen. So, from the time you start designing your facility, the worst of the worst thing that happens is an animal gets out, right?
Mm.
And so one of the ways that you make sure that animals don't escape from your hospital is you have double doors around all your exits. And you think about how those are protected. You think about what are your, we always walk dogs on 2 leashes. And from the very moment we open, we start talking about never events. Like the worst thing that could happen is an animal gets out. And so that's why we always keep one door closed. That's why we always walk animals on 2 leashes. If you're worried you can't control them, don't go out by yourself. So those kinds of things. No cat is ever in the lobby, not in the carrier. Just things. We don't have electric heating pads in our hospital and we don't use hot water bottles because we know that those are common causes of burns. We only use bear huggers. As we build our onboarding checklists, about we never use heating pads and here's why we never use electric heating pads. And we don't put Serenia and Convenia right next to each other in the fridge, and we call them Meropitant and Cipovicodin because you're much less likely to give the wrong drug. And actually, I used to lecture on this topic to veterinary students, and even veterinary students who had been assistants, half of them had seen that error been made where somebody had given Convenia instead of Serenia, right?
Yep.
And so there are ways by you put them in 2 separate spots in the refrigerator, you call them in your medical record system by their generic names, not their trade names, that you start preventing those things. So I think, and then we do have patient safety reporting in our hospital. So we have an icon in every desktop, and when we onboard people, it is one of the first things they're onboarded to that we have it in our handbook that basically says you will never be fired because you made a mistake. But if you do not tell us if you make a mistake involving a patient's treatments or medications, you could be fired for that.
Yep.
And that's a pretty important distinction is that people make mistakes. Everybody's going to make a mistake at some point in their career.
Yep.
But the most devastating thing is if you don't talk about it. And so then, we just did patient safety in our last doctor's meeting. We went through all our reports. We talked about how do you talk to clients when there's an error.
Yep.
And so you just have to sort of, if you care about this, you would try to embed it deeply, and you embed it from design of your hospital to the way you put your drugs out to what you have in your hospital to when you talk about things all the way through how you build your onboarding. surgery checklist. That was one of the very first things that we said. Every single surgery is going to be in a surgery checklist.
Love it. Yeah. Okay. Well, another question is just talking about what happens when you have an error happen in your hospital and how you use that, not to punish people, like you've
Right.
already talked about. We all know this is a system problem. It's not a human problem. But how do you use that to enforce your safety culture and sort of, the initiatives that you move?
Yeah, so I like to talk about errors as, what to do when the worst happens. And I have sort of a 6-point framework I like to use. It's based
Hmm.
on some teaching that happens on the human side. But the step one is the patient always comes first. So as soon as you realize something bad's happened, you need to make sure your pet's okay. Somebody gets a set of vitals, you
Yep.
figure out who you need to call an expert, call poison control, do whatever it is you need to do. And then the very next thing you do is, notify the client.
Hmm.
And I think this is one of the big mistakes veterinarians make, but there's a lot of information on the human side that people sue to get information about what happened.
Hmm.
And that disclosure reduces intent to sue, it discourages, it makes settlements less money, it does all these kinds of things. And so, absolutely right away, you sort of get on the phone with the client, you say, I need to let you know that something happened and
Yep.
it was nobody's fault. And here's what we're going to do about it. Here's how we're taking care of your pet. And then here's what we're going to do next for that. And then part of it is investigate. So you deal with the pet, you deal with the client, you make sure the worker whoever it was, they're okay. And so I think,
Hmm.
our nurses in general are perfectionists. And so when they make a mistake or when we make a mistake, it's devastating. And so saying, hey, do you need to take a break? Take a break. The pet's going to be okay. People make mistakes. We're going to talk about this later. And then you go back and you investigate, you figure out how you're going to prevent it the next time.
Hmm.
So,
Yep.
one of the common things I talk about is in emergency clinics, we put a lot of things through NG tubes, through nasogastric tubes.
Yep.
And many of those things are clear liquids and they're put into IV bags on IV pumps. And so it's super easy to attach them to an IV catheter. I cannot tell you the number of clear liquids I've seen go into an IV catheter. And so, because it's so easy to do it, you need to think about we have a policy where nothing goes into an NG tube that doesn't have food coloring in it.
Hmm.
And so, because when it's purple, you're not going to hook it to an IV line.
Yep.
And so, just that act alone of saying it's Go Lightly, it's, Clinic Care, it's whatever it is, it's purple,
Yep.
makes it much less likely that that error is going to happen. And so you basically say, you go back and you build the system. You then go back and you tell the client how you prevented the recurrence, because that's the other thing clients want to know is how are
Yep.
you going to make sure this doesn't happen again? And then you sort of close the loop there to make sure those systems stay in place long term. And it's not just a one off, but it's written in your SOPs, it's embedded into the way you train people.
Yeah, I couldn't agree more with this stuff. And I remember reading a paper a long time ago that was in human health, of course, because we don't have this kind of data. But you look at the reasons for physician burnout and physicians leaving their career or changing their career or needing a break, and at the top of those lists, the EMR it was a big one, but one of the biggest ones that can change the career trajectory of a physician, especially a young physician, is a patient safety error.
Yep.
It's devastating. And I think that's the part that people don't realize. And so, these tools that you talk about, talking to a client, I used to run this from our intern training program. I loved giving a talk about you overdose a patient. I've done it. Everybody's done it. How do you talk to a client about that? Because we don't have those tools. We're never taught
Right.
those tools. And they are so important for already, an industry already under pressure for staff shortages. So
Yep.
I love it. Okay. So, my last question about this is for hospital leaders listening who maybe aren't as intentional about patient safety, which is understandable. We have enough to do. We sort of just trust our vets. But if they are sort of woken up to, hey, this should be a hospital initiative, what do you recommend for getting started? Like, what do you find a vet in the clinic? What do you do? And are there resources out there you point people to who want to get started being more intentional about patient safety?
Yeah, I think it's hard, and it's super useful to have an advocate or somebody who's sort of really interested in this. I do think that There's a couple places you can get started. So one is there's a website called the Institute for Healthcare Improvement. It's ihi.org.
Okay.
And for people who are very interested in this topic, they have what they call their open school. And you actually pay, it's like $300 a year, and you can take all of their courses as much as you want. And
Okay.
they do have a certification in patient safety and quality, which I did. And it's fascinating. It's super good. You can do it at your own pace. You can do it at home. It's open to technicians and to veterinarians. So you don't have to be somebody specific, but that's a really good way to learn.
Love it.
I'll do a shameless plug. I've got a blog that's called The Vet Idealist, and I have a lot of patient safety stuff on that. It has
Yep.
a lot of links. And so if you're interested and you want some short things to read, they're like 800 words each. And they have, here's the common medical errors, here's some common ways to think about it, here's some things you can do.
Cool.
And so I think those are good places to start in terms of thinking about it. I think another way to start about it is to have a staff meeting and to say, hey, one of the things we want to make sure is that the worst things that happen don't happen again. What have been the worst things you've ever seen in another clinic that you hope will never happen at our hospital? And you have a really open discussion about it. And the more that you as a leader say, I made this mistake, and here's how I felt, and here's how I got to the other side, the more you model that we should be talking about this together.
Mm.
And people often do what you do, not what you say. And so it's really important for us as leaders that when somebody comes to you and says, I made a mistake, that you say, okay, thank you very much for letting me know. Let me get a little bit more details, and then we're going to figure out together what to do with it. And so the more you invite people to tell you and you thank them every time they tell you something went wrong, the more they're going to tell you.
It's amazing. Yeah, great advice. Okay. Well, this is a short form podcast, so
Okay.
that's all we get. I'm going to wrap up with two questions I've been asking everybody. So one you maybe just answered, but what's your one leadership lesson? You've been around the block. Like I said, this isn't your first hospital, which is kind of cool. But what's one leadership lesson you've sort of learned the hard way as a hospital leader that's maybe cost you guys time or money or energy for you that you would tell others about?
Yeah, so actually it's like not patient safety related, although sort of it. And I would
Okay.
say is when you are a leader, you should use your experts. And every time I've hired somebody and felt like, God, this is really expensive. Do I really need this expert? I've been super glad I have. And when I haven't, I've regretted it. So we just had a construction project, huge remodel. I was like, it's just a remodel. I've done construction. I can handle this. I don't need a construction manager. It's so far over budget. There have been so many things. I'm like, why did I not hire a construction manager? So hire a construction manager. That would be number one when you've got a project. And remodels are worse than new builds, probably.
Yep.
And then just use your experts. Like if you're like, God, I don't know what to do, consult with HR professionals, use accountants, use attorneys. They
Yeah.
really help you a ton. And you know what you know, they know what they know, and that really helps.
Yeah, spoken like a true emergency medicine person who thinks we can do it all, right?
Right,
Um,
exactly. Oh yeah, I got this, but
I
you
got
don't.
this. It's a YouTube video away. Okay, last question is what's one underrated tool or feature in your hospital that your team would just riot if you tried to take it away? Of course, besides instinct, you can
Yeah.
give
Okay.
us any kind of process or tool. Yeah.
Yeah, so I was thinking about this and I was like, oh, I'm sorry, Caleb, this is what I'm going to bring up. So we have what we call our triage board, which is actually not an instinct. So
Yep.
we actually like the boards in instinct, but what we find is we have a specific board that's a Google sheet. We share it
Yep.
everywhere in the hospital, and it's our triage board. So as soon as a patient walks into the building, they get put on the board. And we use it and we can time it for when the tech goes into the room. And then we time it again when the doctor goes into the room. And then we can color code it, whether they get discharged, whether they are seen, whether they're admitted. And we have a different sheet for every day. And the great thing
Yep.
about it is we can see it everywhere in the hospital and every computer screen. But then the other thing is because it's actually an Excel document, we have an easy way to track exactly how many cases we saw. And we can also look at how long our longest wait time was
Love
based
it.
on that, both wait time from when they walked into a triaging them, but then also from when the doctor actually walked into the room. And then my husband, who's like sort of a stats geek, can actually put it into R. And so we were able to look at our staffing trends, our caseload versus staffing, to try to get it right, because we can look at trends over months to say, hey, guess what? Every Saturday there's things here. We've got this huge rush right at this point. We need to put another person here. So that's my fun
That's
thing.
awesome.
Yep.
Yeah, that's awesome. I mean, it's the same in human health. It's hard to beat a spreadsheet sometimes at certain slices of data. So that's awesome.
Yep.
Well,
Yeah.
thank you so much for giving us your time today. We greatly appreciate it, and we're going to have to bug you again about some of the other cool stuff you're doing.
Great. Okay. Thank you, and thanks for having me. And again, we love Instinct. It definitely does make our hospitals safer. So.